Well, the world was stunned to find out that last week actor Chadwick Boseman lost his battle to colon cancer. Our Kenesha Dees has some eye-opening statistics.
According to the Alabama Department of Public Health, the state's rate for colon cancer is higher than the national rate based on a study in 2019. The world is still reeling from Chadwick Boseman's death, the actor only 43 years old when he died from colon cancer. The American Cancer Society recommends that people at average risk of colorectal cancer or colon cancer start regular screening at age 45. Screening can often find colon cancer early. When it's small and hasn't spread, it can be easier to treat. Regular screening can even prevent colon cancer. Signs to look for include a change in bowel habits, such as diarrhea, constipation. Rectal bleeding with bright red blood is also a sign to look out for. According to the Alabama Department of Public Health 2018-2019 review, an estimated 2,300 new colon cancer cases were expected last year. Among men in Alabama, black men have a significantly higher rate than white men, with nearly 59 versus 49 cases per 100,000 people. There are also different types of tests, stool-based tests and visual exams of the colon and rectum. Colonoscopies are recommended every 10 years. People who are in good health and with a life expectancy of more than 10 years should continue regular colon cancer screening through the age of 75. And it's recommended that you get screened for colon cancer no matter what test you take. Putting the Valley first, Kenesha Dees, WZDX News.